My name is Dr. Zachary Piotrowski. I'm one of the urologists at Urology Associates. We're really excited to be able to offer in the practice Barrigel, which is a perirectal spacer that helps to protect rectal structures during the radiation and improve outcomes and minimize complications for patients. Barrigel can be used for all different types of radiation, standard fractionation, hypofractionation, and our ultrafractionated cyberknife radiation. The Barrigel procedure is performed by your urologist. It is an office-based procedure. For the patients, when they come in, they are going to be in a different position. We call it lithotomy position. I always tell patients it's kind of like when a woman delivers a baby. Their legs are up in stirrups. Once the procedure starts, we do introduce the ultrasound probe, and that allows us to visualize all of the space for the prostate and the rectum. We have options for oral medications that can help make the procedure more comfortable, or inhaled gas like nitrous oxide. Most of the time we're introducing permanent metal markers called fiducial markers. That's a pretty standard part of radiation to help direct the field of radiation. But after the markers go in place, that's when we deliver the Barrigel. And that's by placing needles through the skin of the perineum, which is a skin bridge between the scrotum and the anus. So no needles are going through the rectum like most people's biopsies. We're going to be able to find the fat space between the prostate and the rectum, and we're able to insert this Barrigel to expand that space and create this preventative barrier to protect the rectum during the radiation. The Barrigel procedure takes about 30 minutes or less, depending on whether we're adding in those fiducial marker procedures. Patients may feel some pinches from the needles and some sting as the local anesthesia goes in. And what I often tell patients is they'll feel deep pressure as the needles go into the prostate and around the prostate. When we create that space to insert the Barrigel, there is a sense of pressure. Patients feel that expansion and almost like they need to have a bowel movement. That pressure will lessen as the procedure completes, the ultrasound probe is removed, and over the next couple days as things recover. I do recommend that patients take it easy that day. I don't want them to go out and do any strenuous activity, play golf, go to the gym. Usually that day and the next day, it's best to kind of relax at home, drink lots of fluids to make sure that the urine is flowing well. Tylenol, acetaminophen can be a great option for mild pain control, and ice to the area sometimes is really helpful. But for the vast majority of patients, say it's not a significant discomfort, not all that different from their biopsy. Significant concerns from the procedure are rare. Things that we always worry about would be misplacement of the gel, placement of the gel into the rectal vault or into the rectal surfaces. The good news is that this particular material can be dissolved in severe cases with an additional injection. For patients who've had prior treatments with radiation or who've had multiple biopsies, sometimes there's scar tissue, which can make the placement slightly more difficult. And it would be rare but possible that we couldn't place the gel because of these issues and would have to abort the procedure and have the patient undergo radiation without the Barrigel. And this is a non-animal derived hyaluronic acid, which your body naturally produces. The hyaluronic acid will be dissolved by your body and its immune system over the course of months after the procedure. So nothing needs to be surgically removed and no additional procedures need to be performed. The Barrigel has a statistically significant improvement in the short term, but more in the long-term outcomes for patients. We also are thrilled to be able to offer Barrigel to improve the safety and the quality of life for patients.